Welcome back, folks. Now I have Dr. Paul Redpath joining me from Dillon Family Dental. I got that right.
Yes.
Every time I say it, I'm like, is it the full?
Yeah.
Is there ridge in there?
It's a long word. It's a long name. We're probably going to change it eventually.
As long as they know where to find you, that's what's important, right?
Mm-hmm.
Now, tell people a little bit about yourself, your passion for teeth, and I remember talking a little bit about actually the importance of root canals just a minute ago.
Yeah, totally. So, main question, why do we want to keep our teeth?
It seems like a silly question. Like, of course I want to keep my teeth, but you actually come across that quite often?
It's true, yeah. Sometimes people forget. They're like, well, it's expensive, all of that type of stuff, but without teeth, we wouldn't be able to eat. Without teeth, we wouldn't be able to talk. Without teeth, we wouldn't be able to smile, laugh, enjoy times with friends and family. So I think it's good to put things in that perspective versus, root canal and things like that.
And I think also in a previous time that you were on, you had mentioned that, okay, just one missing tooth can actually lead to multiple missing tooth. So I think maybe that's what people kind of think is just like why it's fine if I miss just one and it's in the back and nobody can see it, right?
It's true, yeah. Really, it sets up a whole cascade. Teeth are like a complex puzzle, and they fit together just so. And so when one piece is missing out of the puzzle, it puts everything off balance. Root canals are one of those things that sometimes are caused because of cavities. Bacteria get into the center of the tooth where the nerve is located, and they can cause pain and cause pain to cold is one of the main things. Pain to biting is another one that some people will have, and a root canal will fix that.
Now, what is a root canal exactly?
Yeah, so root canal is when a specialist, I don't do root canals, it's the most complex procedure in dentistry. It's microscopic surgery, basically trying to get into the center of the tooth where the nerve is located. They use very thin files, clean it all out. They have a 10x magnification microscope, basically, to do the root canal. And so I always recommend having a specialist do it. The techniques and materials is really important to get a long-term success for that root canal.
Now, I had no idea. I mean, with a root canal, you think, oh, that's just something you go to the dentist for. But is it basically like the same person that takes like your wisdom teeth out? This is a different specialist?
It's an endodontist, which is a root canal specialist. I actually just this morning had my IT guy text me, and he said that he had a root canal done. I'm not going to name any names. Some dentist in Summit County here, general dentist, and they had to redo it. They did it once, didn't work. They had to redo it because he was still having pain. And then it's been a couple months, and he texted me and said he's still having pain. And now that I've taken over at the new practice, and he's been great. He basically, I'm going to have him see the specialist and have him fix it finally and get him out of pain because, see a specialist.
Yeah, that's very good advice. Because it takes what I'm assuming is an expensive and painful procedure. Thank goodness I have not had to need one. And just make it even more expensive and more painful because it's just kind of going on and on and on, right?
They simplify things. That's why I work with him closely. It's Dr. Ackerman and Dr. Cardelis are the two ones up here. I just work with them closely because they make everyone's life easier. It's quicker for the patient, less pain afterwards, and it works long term. We see the results 10, 20 years from now. They'll be able to keep that tooth, and that's what's most important. Anytime it's not done properly, it puts the tooth at risk for being lost in the future.
Yeah, and I think our teeth are something that maybe we kind of take for granted.
Yes.
Right? I think everybody does. I'm sure you probably see it.
Yeah, totally. It's one of those things that teeth really, they make your lifestyle, everything, your overall general health. able to eat all the foods you want to eat, the salad and all that.
You may not realize it until you like bite into an apple or like try to enjoy some crunchy potato chips. And you're like, oh, like I can't really chomp down on these like I used to be able to.
Yeah, and some people they go through for years. They'll have a tooth that they feel like, oh, like it just feels off, and it hasn't ever felt the same. And the main way that I find these things is that 3D X-ray that I take. And you can find if there's any issues with the teeth in the very early stages, and people will just live with this for years. They'll be like, oh, that tooth has always been kind of sore when I bite down, and it's just been that way, and they live with it. There's something going on there we can fix.
And you can probably prevent it from turning into an expensive root canal sort of thing,
exactly.
right?
Yeah, we catch cavities early before they go into the nerve. We can prevent root canals. If it's close to the nerve, there's a procedure I do where it's like I put a medicine close to that area to prevent it from needing root canal a lot of times. So there's many things that we can do to just help your overall health and teeth. It's great.
Well, thank you again for coming in and enlightening us. Now, where's a good place for people to go to find out more information about yourself or book an appointment?
Yeah, so we're located right by the City Market gas station in Dillon. You've seen our sign driving by to go to City Market. Come on in, we're Family Dental, and we'll love to take care of you.
All right, well, thank you so much for coming in.
Yeah, great to see you.
Yeah, okay, folks, we're gonna take another quick break. Do not go anywhere.